Hi, good morning, everybody. My name is Michael Ko, and I'm one of the fellows from Loma University. Today, we're joined by Dr. Krishnan Kousik. He's one of our electrophysiologists at Rush University Medical Center. Good morning, sir, and thank you for joining us.
Thank you very much. It's my pleasure.
Okay, so we are just wondering if you can share to us some of the most interesting trial in electrophysiology that you saw here at ACC.
Sure. Thank you. One of the trials that really has gotten a lot of publicity and has a lot of relevance to us clinically is the RAPID study, which was also published in the New England Journal simultaneously. It's a study that is relevant because the number of implantable devices that go into patients is quite a large number, and one of the most devastating complications of that is a device-related infection. And those infections can lead to a high degree of mortality and morbidity. Leads sometimes have to be removed, and sometimes people get endocarditis, have other valvular problems from these infections. So preventing infections is of paramount importance. The good news is that overall the rate of infections has been getting lower and lower, and in this study, even in the group that was not getting the envelope, and we'll talk about that, was quite low at 1.2%. So this study was showing the utility of a antibiotic absorbable pouch that the device would be placed in, and that would be placed inside of the device pocket that you make under the skin, and then seeing whether the infection rate was lower. And the results of the study were positive for the pouch, as we call it, lowering the rate from 1.2% down to 0.5 to 0.6%. So a small absolute risk reduction, but quite a bit large relative risk reduction.
Thank you for that. And I just have a follow-up question. Considering that low absolute risk reduction but high relative risk reduction, which patients do you think would benefit the most in this new innovation?
That's a very good question, and is the crux of the clinical relevance of this study is that this device has a cost, and the infections themselves have a very high cost to medical systems and to patients. So determining what type of patient might be most useful to use this device is going to be the next step in determining who to use the device on. Patients, obviously, that are going through generator replacements, we know are higher risk. So that would be one patient population that could prove to be very highly useful in. Also, procedures that take longer, such as resynchronization therapy device procedures, or patients at high risk for infection and maybe immunocompromised, multiple procedures. Those are all people that going into the procedure may have a higher risk of infection. But it's a valid question and a valid clinical decision-making tree that every one of us is going to have to decide on, is whether the cost of the device and the relative risk reduction that we see and the small absolute risk reduction works out in a cost-benefit analysis to use the device. The one good thing is the therapy that you're offering does not have a high degree of risk to a patient. It's not like doing a surgery or a procedure where you'll have to weigh the risk of the procedure versus the benefit. Here it's a little more related to cost and whether the absolute reduction in infection rate will be justified.
Okay, thank you very much, Dr. Krishnan, for joining us today. For more videos like this, please follow our website at youtube.com/fitsonthego.